Welcome, everyone, to this episode of your Freedom Hub's presentation of the Free Market Cash Patient. I'm your host, Jeff Cantor, along with Charles Frohman. We're sponsored by the Freedom Hub and a variety of other disruptors out there in the healthcare world, and we're glad that you're here today. We are recording all of these for posterity, so you will be able to find these on any of your favorite platforms. And just now, we've recently added Rumble, so we're really out there in a variety of other different places. We're also here because we're trying to make sure that everyone understands that we're having issues with the healthcare industry itself, and there's some obvious reasons why we're having some problems. And one of the things that we're engaged in at this particular 7 o'clock series is the idea of disrupting that market in a big way. And the platform that we're having great success with doing so is with this award-winning app, which is the WOW platform. And you're going to want to go to the wowadvocates.com to learn more. But this allows you to connect with all the cash patient doctors. It's a place for them to display themselves, to show their prices so you can see what they charge and be able to pay cash for those services. So you can find that to be fantastic. Now, as I said, these are being recorded, and so you're going to want to be able to come to the hub for all of this stuff for a variety of other aspects of what we do at the mphealthwealthfreedom.com site, or you can certainly use the acronym mphwf.com. But when you get here, you'll see there's a lot of different drop downs and things to look at, and we're adding all the time. But the most important thing for today is when you're looking at the home screen here, you're going to see where it says information and events. Well, that's what's about tonight's presentation, and all the rest of them are found. This is where we list the various of shows we do. There was one earlier today. Here we are at this one that's on the right side of the screen tonight. We're going to come back to this one. We also have a one that's begun on Thursdays, which is for financial health. And then also we show the upcoming ones. And then here again are the links to all of those archives for all of the different series that we do on all the different channels. And these are all posted over the weekend. So every Monday, brand new videos are on all of these channels. To give you an idea, here's an example of how we sit on BitChute, Here's the Brighteon, and there's an awful lot of great ones. You can certainly go back and forth and review some of these ones in the past. Extremely importantly is we're going to be able to let you come and see what goes on after the fact, because some of these talks, needless to say, are really only the beginning point for the listener and even for the organization itself. They need help, money, volunteers, phone callers, all sorts of things. So here's your way to connect with them and stay on top of it. And then also we also feature and keep adding to this list pretty dramatically of all of those that are out there fighting for freedom. So these are all the action issues you need to take advantage of to make a phone call, write a letter, whatever it might be. And they're all important. I wouldn't just pick one over the other, but try to do them all. And then also here's those beginnings of the list. You'll see as this expands of all the other organizations that are out there fighting for our freedom. So it's a great, great situation we find ourselves in the midst of. So, but on that note, let's talk about the topic of the evening here. And here's where I'm going to give Charles the luxury of explaining who our guest is today.
Thank you, Jeff. And you showed the Cash Appointments app that did get the award at the Ascend conference that big brokers attend annually to figure out how to save money for these big companies. And Ruth Lininger is one of them. She has Duchess Health trying to solve problems for the health benefits offered in these big companies and institutions. She got her medical degree, and she wasn't satisfied just looking at pathologies of cancer, so she got an executive MBA type degree because she wanted to get into business. And then she became an integrated doctor with some naturopath skills, which we love at the Freedom Hub, because that's where the market is going. Patients want all of the above, not one or the other. And through the development of Duchess Health to try to figure out how to give employees more holistic health, coverage for the expensive catastrophic events, but also how do you get them to behave better and take care of themselves. And it's not just about pills. It's about local community as well. And if you're really going to solve healthcare, she has her own Marshall Plan, if you will, for other health issues. And it gets to issues that are kind of controversial, but which a lot of folks have discovered are important during this pandemic, around the chronic disease epidemic that leads some folks to be vulnerable to COVID, or just the corruption and special interest influence we're witnessing every day in the health bureaucracies in DC, whether it's the Centers for Disease Control or the National Institutes of Health or the Environmental Protection Agency, which is important. If healthcare is a seventh of the economy, and so much else of the economy affects our health, at least indirectly. So I'm excited to hear this holistic presentation tonight, Jeff.
Fantastic. Well, Ruth, I'm giving you the floor here, so please let us have some good information.
Thank you. Thank you for inviting me. This is really an honor to be here. Can you see my screen just to begin?
Excellent.
Let me see, I'll minimize myself. So, my name's Ruth Leininger. I don't have an MBA, but I am completing a leadership and management certificate. I do have a master's of public health, and I have more degrees than I need. But I've learned after studying pathology for 20 and practicing as a pathologist for 20 years in an academic setting that it wasn't so much the diagnosis of disease that was important as the treatment of the patient and the promotion of and restoration of their health. And really came full circle and retrained in integrative and functional medicine, and thought that my voice was as good as any, and that if I had a vision, broad as it is, to incorporate solutions for consumers, that I should speak out. And so it's really kind of changed my whole world, and I'm happy to talk about it today. So I, after retraining, I started basically what's become a health innovation sandbox. So Duchess Health is the platform, and it's really here consumer-directed, community-centered whole health care and health plan solutions. And I really focus on the consumer. Let me see, go forward. Okay, yeah. Really focus on the consumer. So we've all seen these statistics, rising healthcare costs are unsustainable. But if you look at it carefully, you see very clearly that this vast majority, 86% of healthcare costs, go to managing the chronic disease epidemic, which affects 6 in 10 adults. And the consumer and their health is one thing that has kind of gone kind of mysteriously missing from many of these conversations. And the truth is that if you can reverse chronic disease, a lot of these spending issues, the waste, fraud, and abuse, all kind of miraculously goes away. And you have people like folks, who run the Cleveland Clinic, the Institute for Functional Medicine, saying that, if they were to take over the hospital with their type of care, they would empty the surgery centers and a lot of the clinics. And so it is disruptive. But here we are in the post-COVID world. We're now living with this pandemic, and we are ripe for transformation. My predictions are that healthcare spending, cost controlling post-COVID is now imperative. These community health and preventative health initiatives are now essential. I really think we're at a tipping point where a lot of self-funded employers are going to be looking at these community-based health plans and direct contracting arrangements. And the truth is that these consumer-centric health plan designs will deliver better outcomes. And those that are managed well will do the best. really, putting intelligence at the center to improve outcome. And my belief is that focusing on these preventive systems biology-based whole health and medicine care for patients will be essential to tackling the chronic disease epidemic. And paired with our current tertiary care, Western medicine system of care, together they should be the best healthcare on the planet. But right now, we're really struggling. Western medicine, allopathic medicine does not deal with chronic disease very effectively. So in this talk, basically Duchess Health is the platform for scaling this type of care. My target is addressing consumer health, and my goal is to go to self-funded employers and communities to scale this solution. And here's my mission statement. Our mission is to help consumers achieve optimal health by making whole health care universally accessible through our smart platform, leveraging clinical, behavioral, leadership, and managerial intelligence, technology-enabled solutions, and an intelligent health plan design. Wouldn't that be nice to have intelligence in our health plans? And the freedom for consumers to choose their health plan, and one that maximizes their well-being is I think essential. And so the aspect that I am going to point to, though, is that, and I would argue that it's not enough to simply lower healthcare costs through better healthcare. What I'm arguing for is that we need to create economic value from health itself, and I believe we can by facilitating health transformation. We can create health savings that didn't exist before. And my argument is that I believe we should leverage a proportion of that for the good to drive this virtuous cycle of health in communities and to repair much of the damage that has been created over the past 30 years. And the really powerful message here is we can do this outside of government. We can do this outside of policy through self-funded private employers choosing sustainable health plan designs and choosing to match a portion of health savings to reinvest in their communities. And just think of the grassroots power of doing that. And so my vision is that we can make America healthy again. And I was told not, did I have to say again? And I am bipartisan here, but I'm really about consumers. And if we did this right, we could focus America on reversing chronic disease in those that are currently in health plans, 100 million people, and we could do this by 2030. And we should lead, I think, the world with a global health moonshot program, a healthy planet free of preventable disease. And right now we are the poster child for chronic disease, and it's just an abomination. And it doesn't have to be. And so I would say this next slide shows the ecosystem. So I mentioned I created kind of this health innovation sandbox. So I first have turned to creating a cash-based integrative and functional medicine clinic, integrative path, and the whole MD is the brand, taking it to membership model employers. And coupled with the clinical care innovations addressing the root cause of disease is a different way of doing lab pharmacy. And so really at the center, at the bottom there, is it's very small still yet, but we did create an online store, Whole Pharmacy, and the goal eventually is that it's AI driven, and it provides all the things that consumers need that physicians can prescribe when they address chronic disease through health programs. So trying to facilitate consumer health transformation. Duchess Health is the overarching technology platform for bringing this to employers. And then the big vision is Prime Health, a health plan that pays for this kind of care more broadly. When I retrained, I just want to give a shout out. The Institute for Functional Medicine has a certification program. I recommend any docs that are interested in doing root cause medicine to check them out. The Academy of Integrative Health and Medicine is where I got my 2-year fellowship. It really all started with the Duke Integrative Medicine Leadership Program, where I decided to stand up and lead. And I would point out that the functional medicine matrix, most people think of whole health care as just as a mental, emotional, spiritual, it's all about yoga and stress reduction. But functional medicine really is a systems biology approach. It's very science driven, and it's about scientifically assessing the imbalances in an individual, whether it's via digestion, structural integrity, the endocrine system, the cardiovascular and lymphatic transport system, toxicity and detoxification through our mechanisms of elimination, energy regulation via mitochondria, or the immune system and inflammation through defense and repair. And so if we can, and this is what we do and what I do with my patients, is we assess these various imbalances and work to systematically try to restore health to those. And by doing so, you can make a dent on all kinds of chronic diseases. And amazingly enough, the diagnosis is, there may be many diagnoses, and we use the same system across all of them, and individually, it's bringing the system to hold. That's the power of this approach. So this is my cash-based functional medicine practice. I started with Integrative Path as a fee-for-service model. I'm here in North Carolina, and have since moved to add on a membership model. And I'm looking to expand with a kind of functional medicine brand of direct primary care and expand access to patients in multiple states. The value of doing whole health care is that we integrate not only the treatment, but we offer patients access to a variety of different modalities, and it's really up to clients to make the decision what the kind of care they want and what kind of providers resonates with them and that they want to choose. And so it's about health access and health freedom. We do work very intimately and collaboratively with conventional medicine, absolutely. And then on the other end, with the wellness spectrum, and certainly health coaches, nutritionists, these are all really important people when you're doing this kind of lifestyle medicine. And then integrating community care is one of my big goals. And we're looking to partner. We were on the cusp of discussing some really interesting partnerships with some partners who are working with a Y just before COVID. And so things are different now. But I'm also looking to partner with health food vendors and local farmers to provide farm fresh food to my clients, and then to work to scale this more broadly to make this accessible to others. So let me turn to, so Whole MD is the membership model. And you may be familiar or not, but what we provide our patients is we do a very thorough clinical assessment. initial intakes, and this is on a kind of concierge type with individuals, is about 2 hours for folks with complex chronic disease. So it's a very different model. And then we do specialty laboratory testing and routine testing if necessary, and provide a care plan. And then some patients, I may actually prescribe products for them. Some of my patients are older with memory problems. I've actually blogged about this. And we're working on a health management system so that there are prescribable modules so that we can scale this type of care with other docs that may not be as intimately familiar, but have prescribable modules for various chronic disease categories. And I'll go over those in a little bit. Here's the whole pharmacy. It's a a health marketplace and dispensary for dietary supplements. We're working to expand to provide botanical medicines and health foods, and eventually lab and DNA testing. And then whole pharmacy health is the medical home model for patient-centered care, really collaborating across these different companies in the sandbox. And we are working on programs focusing on specific conditions. So for example, a renewed diet and weight loss program. I've got a COVID at-home care and prevention program, diabetes, pre-diabetes. I work with multiple sclerosis and autoimmune patients with a Walsh protocol. I do the Bredesen protocol for Alzheimer's disease and memory care, the Walsh protocol for mental health and substance misuse disorders. There's really an immense science now, and it's not part of our healthcare systems for the vast majority of healthcare systems out there. And I really believe it shows tremendous value, and I think it needs to be studied and to prove that it does. And so I'm looking for strategic partners to study some of these protocols so that they can be more widely implemented and the value is clear. The innovative way we're going about working with chronic disease is we're creating, this is just something I discovered by jumping in and working with patients on a fee-for-service model, is that when you leave patients and you send them back to their homes, things often don't happen until you follow up with them. And so it's all about management, isn't it? Just like managing a health plan. And so I think we need to manage chronic disease and help patients self-manage better. And so I'm working on doing this, and I think this is fairly novel. It's certainly been done for diabetes prevention and some, I think, isolated other circumstances, but we're really looking to do this kind of more broadly and create prescribable modules. The health programs will be not only just individual, but I'm really incorporating group education. So this is another way to scale care and make it more cost effective. When you're doing education, and certainly virtual education, there's no reason why you can't do it as groups. And then make that recordings available for later. And then it's not enough to just provide the education. I think it's important to know that people have understood it and answer any questions. So this is really a bi-directional patient engagement type of care, and I'm very data driven. We plan to gather data. Peer support certainly is a big influencer on chronic disease and outcomes, and that's a part of our approach. I'm working with behavioral health management approaches to do this intelligently to get the best results. And for employers, the value that we offer is we go, and we're looking now just to work with several strategic employers, preferably in the North Carolina area, but we are expanding state access. But our value propositions, we come in, we do an initial readiness, needs, health, and risk assessment of their clients, and develop a customized plan and a strategy and cost benefit analysis. And then we can bring in leadership training, we can bring in behavioral management, the direct contracting, absolutely, and then enroll their employees in a subscription model. And this is all specific based on their assessed risk, and then onboard them to health solutions and care. Let's see here. I'm trying to go forward. Yeah, this is just some parts of the app. I'm going to skip through a little bit of this since so Duchess Health at Work. So we can do, this is of course before COVID, but we were set up to do group health programs on site. Those can be now done virtually, telehealth of course, and the concierge-like care for all is really the value in bringing in incentives and rewards. Here's a direct contracting suite of solutions. Include the ability to scale DPC clinics and EMR using telemedicine, but I've really found the SMS chat, use Spruce Health, is something patients absolutely love. And then providing our custom care plan, and then access to the ability to get everything they need for their care facilitated for them if they choose, and of course it's their choice. And then some cost-saving strategies for the pharmacy, the compounded specialty drugs, etc. And of course, our approach can and partners nicely with medical cost sharing to specifically address the folks with chronic disease that may not perhaps choose that option otherwise. Let's see here. The other thing that we're working on is how do we scale this whole health care to everybody. And right now, since most chronic disease, 71%, is in age 65 and older, and those folks are in the Medicare population, we're experimenting with adapting chronic care management for addressing chronic disease in this population through Medicare. However, my goal is, since insurance does not cover this type of care very well, my hope is that with some healthcare reforms, patients may have the ability, for example, to choose direct contracted, direct primary care, functional medicine care, and have it be reimbursed perhaps from their otherwise fees to the Medicare program. We will see if those kind of reforms would come to pass. I think eventually, my hope is that they do. So this is the Duchess CCM for the chronic care management. And again, this version is starting in the insurance space, but it really is meant to begin the slow work of how do we address Medicare patients and work to lobby to give them access to the kind of care they want. Because I have so many people that come to me and they can't afford to pay cash on top of what they're paying. And it's just, it's heartbreaking, and it's a tragedy because they deserve to have access to this type of care. Modifiable determinants of health, we all know these kind of things. Social determinants of health. So I have to at least highlight that it's a little known fact, but the access to green space has been shown in some studies to reduce the negative impact of social determinants of health by 50%. And so aside from working with patients directly on their behavior, I believe we do need to work on these social determinants, not only just cleaning up our environment access to clean, healthy food, clean air, clean water. But green space is itself healing. Imagine that. We evolved from green space, and apparently we need it to be healthy. And so this is food for thought. The here, this chronic care management reduces healthcare costs by 15%. It's not very well adopted, and it doesn't work well in the insurance system. So this is ripe for disruption and change. Again, my vision is that we eventually can go to Medicaid and Medicare with some of these innovations. I think ACOs would benefit from these, approaches. But right now, the limiting factor is how can we pay for it, and the health plans don't pay for this now. So the end goal is an innovative health plan that does that, and that is something I'm not going to give up on until it happens. So this is, let's see where we are with our time. This is the just the whole healthcare model flow chart. Data, the software for outcome reporting and trending is very important. This is really a very data-driven platform. Here we are, this is an example of one of our tech partners who's working with a Y has a platform, and I'm working to adapt something specifically for Duchess. And again, working with remote patient monitoring at home in virtual groups is the goal, and integrating social services and community care programs to create this kind of patient-centered medical home for whole health care, something that I don't see has been widely done yet. This is a vision of the dashboard when this is all said and done, and this would be specific to local communities, kind of a throw off for actionable health that can be searched. Programs included in the subscription, and again, stratified by disease determinants, healthy, well, rising risk, chronic disease, and complex chronic disease. We are going to be rolling these out. This is the subscription platform for the services. Signature Blue is for, the healthy, well care for the rising risk, restore care for those with chronic disease, and then I call this revive care for those with complex chronic diseases. So these are the folks with like heart disease, early Alzheimer's disease, multiple sclerosis in a wheelchair. And again, the PMPM is very expensive, but the cost of these diseases is expensive. Blue Cross in the Orange program highlights that the Orange program costs, and this is for cardiovascular disease reversal, costs about $8,000 a year for a patient, but Blue Cross saves, so it costs roughly $10,000. Blue Cross saves $30,000, I was told. Capturing not only the healthcare savings, but making available this type of care is cost effective in the long term. So when you change outcomes for health and wellness, you really have to address this whole spectrum. And so I was just going to end pointing to, oh yeah, this is the value for corporations, self-funded employers, whether they be like a town or a self-funded employer or a state, that we bring in a corporate health transformation steering committee. We come in and basically provide a customized data-driven corporate health transformation plan, and then we implement it, and we predict based on, and these are documented statistics. Preventive health services deliver up to 5-fold ROI on average functional wellness programs. The folks I'm working with can deliver up to 15% off the first year, according to their data, and they've done this over 20 years. Direct primary care, up to 15% lower costs over the first year. Chronic care management, similarly. Direct hospital contracting can provide enormous benefit. And so I think there's enormous value. Duchess Health in of itself, just a subscription alone, provides substantial revenue. This really is for an investor slide. Our plan is we contract with employers, contract with health systems and providers, and grow market revenue. And this is just a summary slide of the guaranteed ROI and shared health savings approach. And what happens when you focus on health transformation and certainly picking modest health savings based on various programs that are implemented. And the previous slide, I think we can meet these targets, and we can also offer a captive to guarantee stabilizing healthcare costs and even reducing spends depending on how aggressively an employer wants to implement some of these for their employees. Duchess Cares, that's our community health initiative, community advancement through resources, education, and services. We've got our population health initiative. We talked about the chronic care management, the COVID care prevention and treatment, and vitamin D testing and supplementation. It's all in the news for COVID. It can improve health. And the number needed to treat is only about 3 to 4. It's really quite effective for improving health. This is our peer support for health. And then our plant to seed community gardens is one of my passions, creating green spaces in communities. I have a friend working with me on Iceland model for drug addiction prevention. And there's a really fantastic person here in Durham who's got Purpose University, where he works with, I think it's Black African Americans in North Carolina, especially in, I think he's cited in this Durham community area, and helps them become entrepreneurs. And so really, I think the value is in sustainable programs to help folks and not give them so much a hand out exclusively, but a hand up to create value in their lives in multiple and unforeseen ways. And certainly health is foundational to that. And I'll just run through the hub and spoke model of care. This is one of the innovations I see as the hub and spoke, where community gardens are health hubs. And we can do yoga in the garden and teach nutrition in the garden and address food insecurity in the garden and teach people how to grow food and provide, employment for those, leaving prisons. And they're just amazing things that can be done in the garden. And then my vision of eventually, wouldn't it be great to go to the state and scale some of these things? The leadership for the platform is very tech heavy. These are some of these folks. I've got a slew of amazing advisors and consultants, and with funding, we will begin to pay people. And then just closing, you've seen Dr. Darnold Berwick's radical new rules for radical redesign in healthcare, and he's kind of the leader for the Institute for Healthcare Improvement that started this from CMS many years ago. Tracy Gaudet at the VA scaled whole health throughout the VA with peer support and personalized healthcare plans. Has really been an amazing cultural shift for the VA, and we need to basically to create a holistically integrated and sustainable model for whole healthcare requires not just the consumer and the provider in the community, but of course also the payer, and also the policy has to be right. And so it's a collaborative effort. And sustainability for business, I challenge those out there, everybody listening, that to adopt sustainability in your practices. It's good for business. It's the quadruple bottom line: social, environmental, economic, and health impact. And I'll just close with a, do we have the time? This 3-minute video, very powerful, I think.
Go for it.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So choosing our future as consumers, choosing how we heal our communities, choosing our healthcare and how we transform our healthcare has impact on the environment as well. It is a whole. And I leave you with my piece. This is a blog post, Radically Redesigning Healthcare, a Marshall Plan to Restore Health to Our Communities. I hope it's of interest to folks. I really think we need a dialogue, and intelligent people need to lead this. And if anybody has any interest to contact me, I'd be happy to work with them to scale some of what I've been talking about. Thank you very much.
Okay, fantastic. Well, wanted to definitely open it up for some questions here, and I see we've got some hands popping up already. So let's kick it off here with Charles.
Thanks very much, Jeff and Ruth. Fantastic presentation. What a concept to bring integrative primary care into the workplace. Everyone is caught up with direct contracting and allopathic direct primary care, but speaking for myself, I would rather have an integrated entry point for healthcare with allopathic as a backup. So I think your model has a great future. Do you want to briefly go into some of your larger Marshall Plan points, maybe 2 or 3? Because I think the COVID chaos really opens an opportunity, not just to free up the healthcare mess, but to really take a look at some of the distortions in the regulatory oversight from the agencies above that you've mentioned to me before, with CDC, science independence, depoliticization of the whole healthcare apparatus. Did you want to touch on that?
Yeah, and I can bring you to the blog post. It's under Duchess Health. So there's 42 points. It really was meant to incite thought, but I think the pandemic has highlighted the dysfunction in how we manage. And I don't know if I'm sharing my screen. My apologies. But the pandemic has highlighted how dysfunctional. The CDC has been in being able to talk about information in a science-based free way that's apolitical with states, with consumers. I think there needs to be kind of a depoliticization of some of these organizations that are considered, healthcare organizations. The EPA is another one. The EPA does not protect our air. Another big one is, oh my gosh, has anybody seen the movie Dark Water, about the DuPont class action lawsuit about Teflon? In Europe, they have rules where chemicals are proven unsafe until proven safe. And so that's a completely different paradigm that is, something I believe we should adopt. It would be very disruptive here, but it's done elsewhere. These are things we need to consider if we really want to reverse chronic disease and go back to what we were 30 years ago, which is, a healthier population. It's just, it's not right that people don't have access to clean food, clean, healthy air. I mean, the air itself, air pollution, look at what's going on across the United States. Not to mention, these China and India. Air quality, kills something like 1 out of 8 people globally. I mean, it's like nobody talks about it. It's really bad. I mean, we have work to do. And if government is going to fix these things, we have to do it ourselves. And the communities need to lead. The private, employers need to lead, and we can, and we need to. And so, somebody look at my blog post, and I hope it creates a stir. Probably, it's not 100% there, but it's a document that we should work on. Smart people need to get this right, and we need to fix government to allow us to create health. Sorry.
A lot of fronts to battle. Dr. Campbell, I see you got your hand up.
Oh, sure. A very, very impressive presentation, and I love your career trajectory, how you kind of have really, what you started out to do is not what you're doing now. I'd love for you to, I mean, healthcare policy is such a huge thing to get your head around. And I've been working on this in Washington for years, and I can tell you most of the politicians and most of their advisors are economists, and they just don't know enough to know what makes sense and what doesn't make sense. So I'd be curious what your perspective is. One thing is 2 Thursdays ago, President Trump released his alternative healthcare plan to Obamacare. And it involves a lot of healthcare freedom. But it seems like with your approach, which I think is the best approach, the big question becomes, do we have a government solution? Is the government going to be the one, because they're controlling the dollars now. About 60% of healthcare dollars are now coming from the government. So is the government going to be the answer, or is it going to be wresting control of healthcare away from the government and back into a more privatized marketplace? I'd be curious about your perspectives on that, given all that you've done with your model here.
Wow. So I have to say, I have worked in the government at AFIP. It was, I felt like I was in the military. I was a civilian. And I've worked for, a state, University of North Carolina, a state health institution. And there are clear limitations of working for either a state or federal government when it comes to innovating in healthcare. And I actually, and I remember when the space, NASA was privatized, and, you started to get these big, billionaires investing in the privatization of space and going to the moon and Mars. And I was shocked at that. But I actually believe that it can't be done any other way than through privatizing health reforms, because I think it requires a degree of innovation, iteration, and improvement that is going to take this entire country and the brains and entrepreneurship of this entire country. And we have hard work to do. I mean, our planet I have folks who travel the planet sourcing botanical medicines, and they say we have trashed this planet. And we live in the pristine, beautiful suburbs, some of us in America. But, even across America, you look at our water. Do you really want to eat the fish from the rivers anymore? I don't let my kids. There's mercury in this saltwater fish, that my son catches in the North Carolina coast. I mean, it's when pregnant women can't eat fish anymore,
Yeah.
I just think and the chemicals, like you read Dark Water, they say Teflon is in every living being on the planet, and that it's got innumerable health effects. And I just, when you've got the EPA that's like been sorry, but it's just been bastardized. When you got the CDC that's got the handcuffed, how are we supposed to address anything meaningful when the government is run by people that aren't even scientists and healthcare practitioners and physicians and clinicians? And I put in my 42-point plan, I think there needs to be a branch of government that's health and health science. I just think it's lacking. You look at traditional systems of governance historically on this planet, and there was always someone in the health, shaman or otherwise, at the top of leadership. Because what was more important to a clan, to a community, to a tribe, to a civilization than their health? I mean, when Chinese started, you may not know this, Chinese started Chinese medicine, acupuncture and herbs, so that their citizens would be gainfully employable and productive citizens. And you've got 1 out of 2 American adults now with a chronic disease, and it's just getting worse. This is a matter of national security and national defense. We absolutely need to call the siren and do something about our healthcare. And I don't think, sadly, I really don't think it can be done in government anymore.
Yeah, and I welcome your comments, and from a
But policy is needed. We need policy reform, and I've put some suggestions for those. Yeah.
Yeah. Well, to give you a perspective of where I've been and why I'm asking these kinds of questions, I kind of became an expert on the healthcare supply chain and kind of have helped government to try to reform that, where we could save literally hundreds of billions of dollars. In fact, we were the ones that told the national defense interests that we can't make all the critical medications that our troops need. We get it from China. No one in government was willing to tell them that except us. So we have a lot of credentials, and I've gotten involved in policy, specifically with, I've tried to work with a lot of different people, but I've become very involved with the White House. And we've basically given them a healthcare plan. If you go to their page, you can read it, see how it matches with your plan. I meet with the president every week for 90 minutes.
I heard some good things, and I have to read it. I've been busy.
You have to read it, and we have basically 5 things in there, but it's very consistent with what you're doing. But the policymakers really know almost nothing, and they are so impressed that they feel like I know so much. But the reality is, I know that I don't know nearly enough to be creating any of
Oh my
this.
gosh, read my blog. Take me with you.
So anyway, well, there's only so much bandwidth, but I do meet every Tuesday for 90 minutes with either the president or Mike Pence or his chief of staff or Secretary Azar, and we have hammered out a lot of details. I would love to see you read that, see what you think, see how it fits with your model, because I am convinced, as so many doctors, we're spending more money than ever on healthcare, and we're not delivering good healthcare. When you look at the population,
Right.
we have outbreaks of anxiety, depression, colon cancer, suicide. It's crazy. And I think we've just gotten away. We've become a medical industrial complex instead of a community-driven facility that can deliver real health care to real people. And I'm convinced that we have to get the government out of it more, but that's going to be a fundamental divide. And I never always thought that, but the more that I deal with the government, the more I realize that if you get the government out, you have a better chance of success. So anyway, I invite you to.
But if you've got the ear of the government,
Right.
that's a little different. I mean, you know, there's so many layers. But absolutely, I'm gonna
Well, I went for 9 years knocking on mahogany doors that wouldn't be opened.
Right.
And in the last year, it just seems like all the work paid off. And I literally, you know, I had a call from the White House from Air Force One when he was going to Charlotte about a last minute change. So I guess I've managed to do that. It may only last another month or two, or who knows, you know. But my point is that
Yeah,
we
that's
need
terrific.
to get you connected with our people. We have a group called Free to Care. It has 90,000 physicians and 8 million patients. You're welcome to join. Go Free to Care. See if it resonates with you. But we're trying to unify and create a voice that makes your kind of healthcare possible. And you're right. It gets back to the funding. Who's going to pay for it? And the government pays for 60% of healthcare, and they squander half of that. So then that's where all the money goes. And so anyway, that's my perspective. Thank you, though. I love your work.
It's good. And I'm interjecting just because
so much. Yeah.
we're running up on our time frame a little bit here too. And you know, it's interesting. Charles and I have been doing a varieties both in this patient care world here as well as in other aspects of the world as far as the economy and whatnot. And in the end, 100% of the time, it's getting the government out ends up being the number one beginnings of the solution, because suddenly all the entrepreneurs run in there. We used to have like 1 or 2 people even took a shot, and now you got hundreds trying to beat each other to the punch. So, you know, unfortunately, like you said, the hard part is that they're doing a lot of the funding at the moment, but that can be wrested away. Because as you know, as you just indicated, a ton of it is wasted. So it's just like doing what you're doing, like you said, all these years, and suddenly the door opened. It's just keep pounding away, pounding away.